What I have come to learn is be gracious with yourself as a mother. Postpartum anxiety, stroke blues, it's similar, happens within the first 2 weeks of after giving birth. So postpartum anxiety is where you're feeling, it's just as the word says, you're just anxious. You've given birth, you've been given a small thing, and you're the one who's meant to take care of that one. I've had enough women, they're like, these people are trusting me to go with this one. Like, I've never even taken care of a plant or a dog, and you're being given a human being who is breathing, and you're the one who's meant to feed them. So that's number one. You're constantly looking for them. You're like, are they breathing? You even go and put your hand there and you want to see if there is some warm air coming from the nose. Constantly has the diaper chomed them. So you breastfeed, you're burping, and then you're like, have I placed them properly? Have I burped them properly? Are they still breathing? Am I holding the neck okay? It's a whole confusion. You're just anxious about the day-to-day livings of, especially the baby. Most of the time, you don't even focus on yourself. It's funny, I used to sit at my window and I'm waiting for my spouse. This is me. I'm like, I'm anxious, tapping my foot in bed, waiting. Is he coming back or not? That is a form of anxiety. In your head, you're wondering, is he coming back or not? Not that because he said he's leaving and he's not coming back. Your brain is just worried that he may not come back and you're left alone with a child. Mm-hmm. For example, in a COVID time, people were anxious about what if I go to work and bring my child COVID, especially for healthcare workers. What if I give my baby COVID? What will happen to them? And if I get COVID, is COVID being transmitted through breast milk? There's a whole anxiety period. So it happens for about 2 weeks. Most of us actually go through postpartum anxiety and don't even realize we're going through it. So it is normal to go through it. You have a newborn who you've never had before. Or even though that you had another baby, this one is new and they've come with their own character, their own behaviors. So it's bound to be a different experience. And then postpartum depression takes about 3 months. So from the time you give birth to 3 months, most people start noticing from around month 3. And it can push also forward. So postpartum depression usually has some symptoms. It's like the way other people also get depressed. So you find your moods have changed. You're moodier than usual. So you feel low. You don't feel like waking up. You don't feel like doing anything. You're irritable. So somebody has come, they've asked you, maybe for something like what they want you to help you with the baby, and you tell them, no, wachana na yata nilimza. I want to. So you find you're moody too, especially the people who are around you, and irritable. You find you have issues with sleep. You're not being able to, somebody's actually holding your baby, and they let you go and sleep. When you're in bed, you're struggling to fall asleep or even sleep. So you have issues to do with insomnia, which will also end up affecting you. Remember, we said anytime that you go through a stressful period and you release excess cortisol. Cortisol is a hormone that is a stress factor that usually helps you deal with stress. But if you have prolonged periods of stress, your cells become resistant to the cortisol, which is your stress hormone. So what happens? Your stress hormone is being released to come help you, but it's not working, which means that cortisol is just hovering around in your system and your stress is not being helped out. And that is when you find you're easily gaining extreme weight. Now you're not falling asleep properly, amongst other things. So what happens? Postpartum depression can now end up in postpartum psychosis. At some point when you're depressed, you find you may be having a child. They're crying so much, utaki kumwona. You actually leave the child on the bed and people walk out. Some people even ametoka ameenda kutembea. Those are warning signs that something is wrong. Crying a lot, crying more than you're just crying. If somebody asks you what is wrong, you can't even explain why you're crying. You're crying because I don't know. You don't have an answer. Yes, it's a very weird kind of time. And especially for husbands, sometimes they feel very confused. Okay, I asked you why are you crying and you're not answering the question. So, and men are logical. Like, there needs to be an answer. But it's a hormonal, emotional kind of investment because of the changes in your hormones. And worst of all now, if you've been extremely stressed, there's excess cortisol in your system, which is now a whole different conversation. Postpartum depression can now end up in postpartum psychosis. I don't know if you've ever heard of mothers who killed their babies. Now, those ones have tipped over into something else. Because the natural response towards the baby, this is somebody who can't defend themselves. So some have drowned their babies, choked them, pressed them on the bed, something like. Now you're tipping over into psychosis. Some have left the home. They left and they went and went. Remember, after 1 month, 2 months, 3 months, but they disappeared away from the child. So when you're in that period, immediately when somebody is going through from the point of anxiety, blues, that's why I said you need a support system. When you notice the mother is getting into postpartum depression, please get them help. It is not a bad thing to get someone help. It does not make you weak. It does not make you inferior. Please get them help. Because when you get them help, they are able to express themselves to their psychologist or their counselor about what they are going through. Somebody who can be able to understand them. For the people who are surrounding the mother who's going through postpartum depression, and I usually say this especially to the spouses, because that is the person who the mother is most linked to. Help them and let's get help. There are people who, even before they give birth, they already start noticing breast milk is coming out before they give birth. So it can happen, so that should not surprise you and make you so weird. And immediately you give birth, it's surely advocated that you start breastfeeding your child within the first 30 minutes to 1 hour. It also creates the bonding. Immediately you hold the baby, there's just that feeling and hormone that comes in as you're saying the oxytocin, it just relaxes you and also starts stimulating the breast milk. Sometimes it may not happen because maybe you went for a cesarean section and it took longer than usual, or God forbid there was a complication. You had to be taken for post-op care, and baby had to be taken to be seen by a pediatrician. So sometimes it may not happen, which you have to be gracious with yourself as a mom, because you'll start feeling bad. There are things that you're usually told before you give birth. I had let us all give birth vaginally as much as possible, and then you end up with a cesarean section, and then you start feeling bad. That is already a process that has started. You mentally put in your head that I'm not a good mother, that I give birth. No, as long as you've given birth to a healthy baby and you're also healthy, you're okay. Both of you are okay. Don't feel bad about it.